Hey there, welcome back to COG 266. Today we are going to bridge the gap between brain and mind by looking at a very interesting specific case of how a pretty radical surgery can really change the way a mind works. This is called split brain surgery. So, split brain surgery is also known as a corpus callosotomy. The corpus callosum being a specific brain region we'll talk about in a second. It's a really radical procedure to reduce the interhemispheric connectivity of the brain, and it's really only used for severe cases where patients are continuously suffering from a large number of seizures, something that when there's no other options, right? They've tried all other kinds of therapy or medication or other things, and it's not used often. In fact, other interventions these days, they help solve these issues kind of before it comes to this, right? But this is a historical, last-ditch effort. So first, what is the corpus callosum? It's a thick, fibrous bundle of neurons between the hemispheres of the brain. It connects the vast number of all the different brain areas we talked about, right? All that we know, there are lots of modules that are going to be moving information around. Once they get up into the cortex, up into the brain, not just in the early vision areas, for example, where we're moving edges around and all that fun stuff. This is really, it's heavily myelinated white matter, meaning it's sending a lot of information a long distance and not transmitting it to things that are right next to it, right? It's a highway of sorts, right? A superhighway of the brain. So this is the chunk of your brain that connects the left and the right half. So your two hemispheres of your brain, you have your left and your right half of your brain, they are mirrored. They have a lot of the same things in common, but they have some division of labor. So most functions are present on both sides, and they just exist in both places, and the corpus callosum will connect the same information on the same features on the left half and the right. But other functions only exist on one side of your brain or the other. We'll look at that in a second. So there's kind of two flavors of this division of labor. So you may have heard of this before. The spatial division of labor is that some of what is different between your two hemispheres of your brain is just which things they are sensitive to in the world. So the left half of your brain, for example, is going to take all the inputs from the right half of your body, and same for the other side. So when you touch something with your right hand, you are receiving that input on the left half of your brain. Just like in the right part of your visual field, that's going to left brain. Left part of your visual field, that's going to right brain. So essentially, this is the part where it's very clear that these are the same kinds of processes happening, but they just happen to be separated across the brain hemispheres. There's also more functional, more peculiar differences. So most speech production, for example, is in the left half. There's very little speech capability in the right half of the brain. But in the right half, you have more spatial relationship processing. So there's more in the parietal lobe on the right half. You're getting a lot more like, how do things fit together? What are relationships and spatially, but also maybe conceptually? And the left half, though, is it still has a parietal lobe, but it's using it for more like language and mathematical reasoning processes. So the parietal lobe is doing the same kinds of functions on both halves, but they are doing it to different kinds of information. Now, I hope that what we've talked about from brain helps to illuminate this and say, okay, well, that just means that some of the information is going to one half and some of the information is going to the other half, and it's getting processed in a different way, right? The right half, parietal areas, are going to be dealing with a lot of transforming, spatial relationships from the visual system, whereas the left half won't be getting as much of that visual input. So, point being that this all is it all follows from the idea that the brain can be wired up in lots of different ways, right? Different areas of the brain. And we can see a little overview of what kinds of features are present. So again, look at the left and right visual field there at the top. You have, in each eye, the left side is going to hit the right back part of the retina, and that'll be piped off to the right side of the brain. Down at the bottom, you see the right visual cortex, right? Same thing on both sides. This is one of those examples of just spatial division of labor. It's the same kind of process, right? But then as we look at other things, we see different kinds of features that seem to be more useful on, or perhaps more used on one side than the other. So, for example, in a similar region on the left side, you have writing, so the production of symbolic language using a pencil. But on the other side, you have maybe more analysis by touch. You're a little bit, the touch information is, or rather this area of the brain that is tuned to do touch type information is doing two different things on either half. So that's the general idea, is that you have altogether, these things are all different kinds of little pieces of thinking that you have available to you. And our friend, the corpus callosum, right there in the middle, is making sure they all keep talking to each other properly. So, here's a quick aside, something that you should hear from me and many others. You may have heard of this concept of right and left-brained people. Right-brained people are more emotional and more, they see the conceptual big picture, whereas left-brained people are more logical and detail-oriented. This is stupid. I'll just say it outright. This is not true. This is not a thing. This is not about dominance of one chunk of your brain or the other. You are incredibly messy and unique, of course. Everyone is going to have different styles, different things they've learned, different ways their neurons have grown and been trained. But this idea of this dichotomy of like there's right brain people, left brain people, that's nothing, right? So there are definitely differences, right? One person's spatial reasoning might be far better than somebody else's. But this is not, it's a reductive way of trying to categorize people, in the same vein as zodiac signs, blood types in some cultures, that kind of stuff. So we use all the regions of our brain. There is not one person, if I remove the right half of all your brains, you're all gonna be affected in a very similar way. Sorry, this is not a threat, I promise. But the idea is that this is one of those things that bubbles up into pop culture, not a really good actual scientific basis for it. We'll tackle another one here in a minute. So, the corpus callosum is the thing that helps keep both halves connected to each other. It keeps them up to date. It coordinates new types of processing. It lets you coordinate and plan whole body behaviors. Why on earth would we ever want to cut this? Well, let me tell you about epilepsy. Some of you may already know this. I have a family member, a brother, who has a pretty severe form of epilepsy. It is a scenario. It's a situation. It's a broad category of fairly related neurological disorders. What happens is it results in this inappropriately increased neural activity, aka a seizure. So what's going on in a seizure? So we talked about how neurons can be affected to increase or decrease their sensitivity. We can increase or lower the threshold, right? Some neuromodulators, some neurotoxins do these kinds of things. In seizures, there's such a spread of neural firing and increased sensitivity that causes this uninterruptible cascade of activity. becomes wild. It's difficult to inhibit. The rest of your neurons might scatter to try and like hold things down, and they just won't be able to. Remember how we talked about how a single neuron firing, right? It has a cascade of activity that it can't be stopped, right? Once the stuff starts moving down the axon, the signal is going to go down to the end and jump to the next thing. Think of that in the same way as this scenario, except it's all neurons triggering each other. It is an unstoppable cascade. So, what actually is happening in a seizure, though? So this is what happens in the neurons. What happens to the person? There are two major types of seizures. There's focal and generalized seizures. Focal seizures are going to affect very specific brain regions, creating impairments like focus. You might lose your focus, you might attention. Some people who have seizures, they'll space out. They'll just kind of stare off into the middle distance, right? Or they may have issues where suddenly they'll be incapable of producing language properly, and that's not, it's not the same as a stroke. It's a temporary condition that they can then, hold off. So focal seizures are these very specific brain regions get affected, whereas generalized seizures affect almost all the brain all at once. So this is the two sort of broad categories of seizures. There's other kinds of seizures within this. So in generalized seizures, tonic seizures cause a sudden stiffness in all the muscles. So the idea being that your muscles all activate, right? The opposite case is atonic seizures, where you suddenly lose all muscle tension, right? So your muscles all stop activating, right? So we haven't talked in great detail about muscle movements, but the same way sensory organs or sensory what's the word? Sensory receptors will take information from the outside world and convert it into neural activity. Your muscles are going to convert neural activity into muscular activation. So your muscles fibers will either tense up if they're being fired on, or they won't. So tonic seizures are too much, all the firing happens, versus atonic seizures where suddenly you lose everything, right? And you might collapse on the ground. Clonic seizures are this sort of cyclical thing where you will repeatedly stiffen the muscles and get this sort of continuous activation. Tonic-clonic seizures, these are the ones that are probably most well known because they're the most dramatic. This is what I have experience with, known as grand mal, as in big bad seizures, where it's stiffening of muscles, then repetitive jerking muscle movements throughout the body. So tonic-clonic seizures are the big ones that they cause a lot of real immediate danger to the person suffering them. And not that atonic seizures couldn't be terrible as well, but it's more that a tonic-clonic seizure, you can bite your own tongue, right? So it can be a pretty bad situation. So, this is a moment that I'd like to discuss. These are pretty bad situations. Here's another little myth I can dispel for you. Only use 10% of our brain, do we? False. This is super false. I can show you how much of your brain you use. The idea is that the grain of truth in this pile is that only so much of your brain is active at any given second, right? Your neurons are doing different things, and in fact, most of them are still doing something, right? But the idea is that there's this higher capacity, and some movies get into this whole thing of, oh, if only we could unlock the potential of the brain. I'll tell you what happens if you unlock the potential of the brain. You have a grand mal seizure when all of your brain cells are firing at the same time. So it's a bad scene. I considered showing a video of a grand mal seizure. I'll leave that to you if you're curious. It can be just a little bit overly traumatic. I'll find a better example of it in the future, but it's not a great scene. So back to epilepsy. Most people with epilepsy can find some form of treatment, right? There are therapy, types of therapies, types of self-regulation, de-escalation things you can learn to do. There's medication that can help you, change the neurochemistry, right? So as we've discussed with lowering or heightening the thresholds of the neurons, you can take things that keep that even, right? Make certain neurotransmitters more and less active so that they, not transmitters, more like the modulators, more and less active, right? To dampen or heighten this whole thing. So that's great when it does work, but some people aren't so lucky. Sometimes the neural activity is so severe that you have to do something like surgery, like an invasive brain surgery, to make it work. So that's where the corpus callosotomy comes in. In a lot of cases, the corpus callosum is the fastest way for information and activation to spread through the brain. So the idea is, well, if we shut down the highways, this type of extreme cascade will be slowed to the point of stopping. In fact, it may never even be able to get off the ground in the first place. So the surgery was first tried to cut down on the brain's connectivity in a general sense. So nothing else is cut, right? It's not going all the way down to the brain stem and screwing with things that like mess with your breathing and heart rate and balance and stuff. It's just the connections between the cortex at the top level. Now that I say just is a four-letter word. Of course, this is a pretty damaging and invasive scenario. But the idea is you cut off the ability for the ping-ponging cascade of neural activity to transfer all over the brain. So what happens to the mind of the person who you just cut in two? If you separate and cut off the connections between different brain regions, but you preserve all the basic stuff, what happens to the person inside? So, for the rest of this segment, this video, we're going to watch some other videos about patients who experience corpus callosotomies to help manage their seizures. And what I want is for you to think about how this has affected the day-to-day experience of these people. And they show you in the videos, but we can pause to discuss and such. So, let's get started.
The cortex, the wrinkled outer layer of the brain, orchestrates talents and skills. It's a network of nerve cells. Music, language, mathematics, problem solving, and face recognition all are activated here among the billions of neuronal connections. The two halves of the brain may look alike, but they're not. They're asymmetrical. They don't have identical skills and abilities. Each side has its own way of knowing the world and processing information. By and large, each side controls the opposite side of the body. When you move your right hand, the left side of the brain is at work. When you move your left hand, the right hemisphere is in control. Most people have a dominant hand, a sign of the brain's asymmetry. Most mental functions, like language and spatial skills, are generally housed in one hemisphere or the other. This division of responsibility makes evolutionary sense. Normally, both sides of the brain work in concert. A massive system of fibers called the corpus callosum carries impulses to and from each side.
Have a silver clip ready, please.
In the early 1960s, surgeons revived an old technique of cutting the corpus callosum to control massive seizures in some epileptics. The operation works. It also provides an opportunity to study the different properties of the two hemispheres.
Right hemisphere is gently moved away from the midline.
Vicky is a split brain patient. Because of her epilepsy, surgeons severed her corpus callosum. But now her right hemisphere can no longer communicate directly with her left.
I knew what I wanted to wear, and I would open up my closet, get ready to take it out. My other hand would just take control. It would reach in and get something that I wouldn't want at all. And then I get, I don't know, frustrated, and I throw the one on the bed that I don't want. A lot of times I can't even hang them back up.
This antagonistic behavior between hands occurs only right after split brain surgery. It takes special testing to reveal the different processing styles of the two hemispheres. Vicky is tested frequently at Cornell Medical Center by Dr. Michael Gazzaniga.
Okay, look right at the dot.
Okay.
The tests are designed to send different kinds of information to each hemisphere.
I simply want you to describe them to me. Just name the picture you see.
Okay.
Okay?
All
So
right.
get ready and look right at the dot. Fixate the dot. Look right at the dot.
Football. Shoe. A woman. A person.
What else?
A girl. That's all.
Okay, I tell you what. Open your eyes. Your left hand. Right what she was doing. Close your eyes and just let your left hand go.
Vicky's right hemisphere doesn't have the language to describe the whole picture, but it can express itself through her left hand.
Good. What did you write?
Skipping rope.
Huh?
Skipping rope.
Skipping rope? Let me show you what you wrote there.
Telephone.
Yeah, what was she doing?
Talking on the telephone.
Remember that?
Yeah.
Good. Perfect.
Vicky saw the picture on her left. It went to the left side of both eyes. The visual information then traveled to her right hemisphere. It understood the picture, but could only say, woman. Then she was instructed to write using her left hand. Her right hemisphere directed her hand to spell out the other feature of the picture. Dr. Gazzaniga asked what she had written. The left hemisphere tried to guess. It had not seen telephone, so it searched for a word somehow associated with the image it had seen. When both hemispheres saw the written word, the left, which had heard the right say woman, could now give a complete description. Woman on the phone.
In Vicky, we are able to test the separate functioning of each hemisphere by the special kind of lateralized testing that you saw. In particular, in the case where we present visual information in her right visual field, which is over here, that information is projected in her left hemisphere, which is the normally dominant language and speech system in you and me as it is in Vicky. That means if I flash a letter over here, she can normally name it, a picture, or anything else. However, when you flash the same kind of information in the left visual field, which goes to the right hemisphere, you find that Vicky is not able to easily name it because of this structure having been sectioned. The communication between the two half brains has been eliminated. How about another one here? You're doing just perfect. Oh, this is a good one.
Huh. I don't know how.
Both hemispheres respond to the words. The left triggers her smile, the right makes her clap.
So what did you see that time?
Both sides receive the command at the same time. but the left side can communicate its awareness.
So you can see from this video how Vicky there's definitely a separation in the types of things that she's able to respond with and where in the world the information is going inside her brain, right? But you also see there is still some amount of coordination. You know, she is still clapping with both hands a little, a very gentle clap there at the end. And just to illustrate that the highest level, you know, the cortical things that were cut still have access to sort of whole body coordination type things too. It's two sort of now separate processing banks accessing the same overall architecture of the brain, of the body, of the whole thing. Okay, let's watch another short video about a different patient. Very similar, but just to give you an additional data point here.
I know the left hemisphere and right hemisphere now are working independent of each other, but you don't notice it. Now, you just kind of adapt to it. You don't have any feeling, it doesn't feel any different than it did before.
7 years ago, Joe had brain surgery to allay the effects of severe epilepsy. His surgeon cut the nerve fibers connecting his left hemisphere with his right. While the operation was a complete success, Joe's unusual case offers an extraordinary insight into the machinery of mind.
So it hasn't really made any...
This fiber system, the corpus callosum, is located midway between the two hemispheres. When it was surgically severed in Joe's brain, the transmission of information between the two hemispheres was halted. Michael Gazzaniga.
What we can do is play tricks by putting information into his disconnected, mute, non-talking right hemisphere and watch it produce behaviors. And out of that, we can really see that there is, in fact, a reason to believe that there's all kinds of complex processes going on outside of his conscious awareness of his left half brain. Joe, I'm going to show you some things. I just want you to tell me what you see. And here we go. You ready? Look right at the dot.
Okay.
Right. Okay, you ready? Look right at the dot.
Grapes.
Good. When Joe focuses on a point, look right at the dot, everything to the right of the point goes to his left brain, the dominant hemisphere for language and speech.
Look right at the dot.
So we can see here that when we flash a word or a picture,
Tree.
Joe is easily able to name it.
There we go. See it.
Close your eyes and let your left hand do a little work here. Okay, what do you got there?
Pan.
Okay, very good. Now, when a word or a picture falls to the left of a fixation point, that information goes to his disconnected right half brain. And as we can see here, Joe is unable to name it. Joe is able to draw the picture with his left hand, the left hand getting its major control from the right half brain. What did you draw?
Okay.
What did you see?
Wheel on one side. I don't know where I saw on the other.
So even though he can't name it, his left hand is able to draw out a picture of the stimulus of the picture or word that we presented to his right half brain. What did you see?
Saw a hammer.
So just close your eyes and draw with your left hand. Just let it go. That's nice. What's that?
Saw.
Yeah. What'd you see?
Hammer.
What'd you draw that for?
I don't know.
what we have with Joe is just a dramatic example of a neurologic case that really allows you this window into the non-conscious and how powerful non-conscious processes are at influencing our conscious self, our personal self. What Joe and patients like him, and there are many of them, teaches us is that the mind is made up of a constellation of independent, semi-independent agents, and that these agents, these processes can carry on a vast number of activities outside of our conscious awareness. Even though that goes on, there's some final stage or some final system, which I happen to think is in the left hemisphere, that pulls all of this information together into a theory. It has to generate a theory to explain all of these independent elements. And so, and that theory becomes our particular theory of ourself and of the world.
So, I hope this has illuminated how you can have a pretty radical separation of some of the processes of the brain, and how it can really affect. I mean, it's obvious that it can affect your brain, right? Your mind, your experience. These are your neurons. This is how your mind works. Of course, cutting a bunch of them would cause a radical shift, but it's fascinating to watch specifically how it happens, specifically what it does. One note before I leave off with this is that they keep saying that, that the non-conscious part of your brain, the right half is the non-conscious. That's really a rudimentary and pretty, honestly, I'm going to throw shade at these guys, foolish take on what consciousness is. Just because he can't speak doesn't mean he can't express himself. He was expressing himself with his left hand. That's not, he says, he's clearly not, no one's home on the right hand. Like, that's foolish. And we may get into how. So, all that said, that's it for today. And I'm going to leave you with, as always, a final thought. Consider moments from everyday life where your neurons just aren't quite making ends meet. Moments of deja vu, when something's stuck on the tip of your tongue, fumbling a well-practiced movement, forgetting why you entered a room in the first place. How might these moments relate to the lived experience of split brain surgery patients? What do they have in common? What's different? All right. That's it. Thanks. Take care.